When you walk into a hospital at 4 a.m. in the morning, you can be sure that a doctor will be there. But the doctor treating you may have already been awake for more than 20 hours. And until recently, many of them were effectively being paid around 9 ringgit an hour for that shift. Today, let's talk about how the on-call system for doctors actually work in Malaysia. Most of us only see hospitals from the patient side. We arrive, we register, we see a doctor, and hopefully go home healthier. But hospitals operate 24 hours a day every single day of the year. While we are celebrating Raya, Christmas, Deepavali, or Chinese New Year, hospitals are still functioning. Which means someone must always be there to respond to emergencies. Because heart attacks don't wait until office hours to happen. Accidents don't stop after 5 p.m. And that responsibility to take care of you usually falls on doctors who are on call. In Malaysia, the typical hospital workday for doctors runs from 8 a.m. to 5 p.m. But for many doctors, that is only just the beginning. After finishing their normal shift, they may still be scheduled for on-call duty overnight. There are a few types of on-call. Sometimes it's a passive call, where a doctor might be called in for a few hours if needed, but sometimes it's an active call, where the doctor stays in the hospital the entire time, handling emergencies, ward issues, and urgent procedures. And during these tours, the work can be intense. An active call can stretch more than 15 hours on site, and if that call ends on a weekday, the doctor often continues working the next day as well. Bayangkan ni, kau masuk kerja pukul 8 pagi, habis biasa pukul 5 petang. Lepas tu continue dengan on-call sampai pukul 8 pagi esok. Cuk, masa itu tak boleh balik lagi tau. Kau masih kena kerja 8 pagi sampai 5 petang on the second day. Maksudnya, jaga patients 33 hours straight. Imagine making complex medical decisions, doing a surgery, or managing critically ill patients after being awake that long. That is a reality many doctors face. Let's talk a bit about how doctors are compensated for this overtime work. Before 1994, doctors in Malaysian public hospitals were expected to do on-call duties without any additional allowance at all. Zero. Nada. After finishing their normal shift, they were still called to manage emergencies, admit patients, or assist surgeries through the night, with no financial recognition for those extra hours. It took years of negotiation before that changed. A key role was played by the Malaysian Medical Association, MMA, particularly its government doctors section known as Section Concerning House Officers, Medical Officers and Specialists, SCOMOS for short. In 1994, the government formally introduced the first on-call allowance. It was called Ilawan Kerja Luar Waktu Pekerja Biasa. Now, the rates weren't great. 20 ringgit for house officers, 60 to 90 ringgit for medical officers. But over time, it gradually increased. By 2012, the on-call allowance for a medical officer doing a weekend active call reached 220 ringgit per shift. And then it stayed there for more than a decade. When you divide 220 ringgit across the 24-hour shift, it comes to roughly 9 ringgit per hour. And that number is reflective of the deeper frustrations within the system. Let's pause for a moment and think about this. In Malaysia today, if a member of parliament attends parliament, they can receive 400 ringgit a day just for attending a sitting. But the doctor managing emergency patients through the night for an entire 24-hour on-call shift was earning 220 ringgit. Far less than that. Now, this is not about saying one job is more important than another. But what does that say about how we value healthcare labour in this country? In October 2025, the government finally introduced a long-awaited increase. On-call allowances had been raised by about 40%. For medical officers, a weekend active call will now increase from 220 ringgit to 300 ringgit. For specialists, it goes up to about 350 ringgit. In hourly terms, that works out to about 12.5 ringgit per hour for a 24-hour shift. It's a small improvement, but still far away from the 25 ringgit per hour advocated by the MMA. Moving forward, we should probably look beyond just allowances. The bigger question is, how do we make the system safer and more sustainable? One idea is something doctors call pre-call off. So if a doctor is scheduled for overnight duty, they don't work the full day beforehand. They start the call rested. Or another option is post-call off. After completing an overnight call, the doctor is allowed to go home and rest, rather than continuing to work the entire next day. In some countries, hospitals has even moved towards true shift systems. Day teams handle daytime work, night teams focus purely on overnight emergencies. These models are not simple to implement. They require manpower and a lot of planning. But they recognize that fatigue affects performance, and in healthcare, fatigue can affect patient safety. This is dangerous and we do not want that. So the next time you see a doctor working late in a hospital, remember this. Behind that white coat is someone who may already have been awake for more than 24 hours, serving patients, often at the expense of their own rest, comfort, and health. And that brings us to a question worth thinking about. If a pilot cannot fly a plane after 24 hours without sleep, should a doctor be expected to treat patients after being awake for 24 hours? Maybe it's time we rethink how our hospital schedule work. What do you think? Leave a comment. See you next time.